Zika virus, a virus that is really instilling a lot of fear in millions of people in Latin America. And the reason for these fears is the increase in the number of babies that have been born with microcephaly, predominantly in Brazil, but in other areas as well. So microcephaly is categorized by a circumference of the head upon birth. And so when you get to certain size ranges, you can be classified as having microcephaly or with severe microcephaly. With this increase in microcephaly cases, corresponding, it seems, with an increase in Zika virus, a lot of people are very concerned that Zika virus leads to microcephaly in newborns. There is more and more evidence. Today is March 15th, 2016. There's more and more evidence that is pointing to that direction. However, we do not have definitive proof that this is the case yet. So microcephaly can lead to things such as seizures, hearing problems, vision problems. Babies have a hard time with movement and balance. Certain milestones such as standing, talking, walking, all of those can be delayed developmentally in babies that have microcephaly. They can have difficulty swallowing as well. There are other studies showing that some fetuses right now via ultrasound are having other developmental problems in mothers that may or may not be infected with Zika virus. One of the issues with being able to definitively correlate babies with microcephaly and Zika virus is that you need to actually show that the baby or the mother has been infected with Zika virus and that baby has microcephaly, and you need to show a bunch of mothers that has not been infected or baby that has not been infected with no microcephaly. So there's a lot more to it than that, but that's just a very simplistic look at how you would find out. Some of the issues with determining this is that Zika virus appears to be in the bloodstream only during active infections. So if you were infected at the beginning of your pregnancy, for example, and you were infected and your body cleared it out, well, after a few weeks, you may have no presence of the Zika virus at all, and so we cannot tell. One test that can be done to see if you were prior exposed to a disease is analyzing the antibodies, right? This is done all the time. However, so for example, if you were to get infected with Zika virus, you may have very mild signs and symptoms. You may not even realize it was Zika virus. Your immune system clears it out, and as part of that is an increase in antibodies. There's a specific towards that virus. And then once the virus is cleared out, you still have certain production of antibodies. And so depending on the infection, depending on the infectious pathogen, whether it's Zika, whether it's dengue, whatever it is, there are certain windows of time where antibodies will be produced. The problem with Zika virus is that some of the early testing, at least, for antibodies against it, the tests cross-react with dengue fever. Dengue fever, or cross-react, with antibodies towards dengue virus, which causes dengue fever. And so this is really important because dengue virus and Zika virus are part of the flaviviruses, as I mentioned in another video. And so they are close enough in structure, although very different in a lot of ways. They're close enough in structure that some antibodies will cross-react with tests. So if you had previously been infected with dengue virus, you may come up with positive with some of these early Zika virus tests if they're based on the antibody, because Zika virus and dengue virus are very similar, and so the tests will cross-react. So scientists are working very hard to try to figure out the best way to detect this. Right now, the way to detect an active virus in the bloodstream is to analyze for the RNA genome, right? So we used that term before with influenza. So yes, indeed. I mean, if I lived in an area that was hard hit with Zika virus and I saw, right, loved ones, friends, even people on the street that were pregnant, thinking about microcephaly is very scary, absolutely. And when you see images, and this is just one example, of an actual baby instead of just, a drawing, it hits home even more. What we're looking at here is a graphic from the World Health Organization showing the distribution of confirmed cases of microcephaly, which is the gold. So anywhere you see gold on this map, those are the districts with confirmed cases. Now, where in that region, we don't know from this. The red dots are showing the number of cases, right? The microcephaly case count, to show you regions that are higher. However, when we look at this red dot right here, for example, they're not all clustered right there. That particular state or federal district, you'd have to follow the boundaries, it's larger. But still, what we're seeing is a number of cases clustering in certain regions, predominantly, but not only Brazil, of microcephaly, and that is where we also have a high cases of Zika virus. However, there are some areas, Colombia was one example that has been in the news a lot, where there is a lot of Zika virus and no microcephaly. And so again, you need to be able to show a cause and effect or a direct correlation. So when you've got women who've been exposed to Zika virus and they're not having microcephaly, well, maybe there's another cofactor, another causative reason. So there's a lot of work to be done, right? But this is the kind of the early epidemiology. It's very interesting following diseases in real time and seeing the information initially, especially when the media starts really hyping it up and starts saying things that are incorrect or only partial truth, and then people are left with really what's going on. And then over time, we see that as the science come out, as the public health officials continually update with more and more solid information, we get a much better view, and then typically the media will ratchet it back a little bit. Okay, so this right here, so there's microcephaly, but also another affliction, Ganbare Eye Syndrome, or GBS. Now we're seeing an apparent increase in Ganbare Eye Syndrome as well. Ganbare Eye Syndrome is essentially an autoimmune disease where your immune system is now attacking aspects of your peripheral nerves, right? So for those of you, you may have all taken anatomy and physiology. My guess is that you have, since you're all nurses. So the myelin sheath is specifically what is heavily destroyed. And you know that the myelin sheath is one of the insulators. It is important for appropriate nerve transmission. And so by seeing an increase in Ganbare Eye Syndrome, a lot of scientists are looking to figure out what's going on. Is it that as the immune system is trying to attack the Zika virus, there's some other aspect that's going on that's causing it to attack your peripheral nerve system? We don't know yet. All we can see is that in areas, so for example here, in the dark red, right, and again, these are big swaths. It's not like everywhere in Brazil, just because the whole country is colored that. But what that means is that Brazil, if we look up here, is the key, is reported or indicated Zika virus transmission with increased incidence of Ganbare Eye Syndrome and microcephaly. So all three, Zika, increased microcephaly, and increased Ganbare Eye Syndrome. And the others colors, right, you can look and you can see that, for example, here, this kind of fuchsia one is Zika virus with Ganbare Eye Syndrome, and areas that outbreak are terminated. So the only thing you really need to be concerned with this, I'm not going to give you a map and ask you where all this is going on, either for this or this, right? I'm not going to ask you to pull numbers out of any of these. I want you to be able to just be very aware of this topic in some specifics, like microcephaly, what it is, right? That we don't have definitive evidence that it is causing microcephaly, but why we have a lot of concerns, because there is mounting evidence suggesting that. This whole increase in Ganbare Eye Syndrome is also something that you need to just understand. So before we get into the transmission, let's just talk a little bit about the signs and symptoms of Zika virus if you are infected with it. A lot of viral infections will give you the same general signs and symptoms, like aching joints, a fever. Right? Those are two common ones that you may just have, and if they go away, you just felt under the weather, and you may never report it, right? Those symptoms you can get from influenza. They can be early parts of Ebola. They are found symptoms of Zika virus. So a lot of these general, fever, sore joints, things like that, lethargy, those are, hard to, you can't assign any disease agent with that, right? So the most common ones for Zika are joint pain, fever, rash, and conjunctivitis, right? Red eyes. The illness, is typically mild. For people with healthy immune systems, and when you are pregnant, your immune system is compromised, right? You are protecting the baby, but your immune system is compromised to some degree. But the illness typically 2 to 7 days, give or take. Most people that get it, it's believed, they just get better on their own. They don't even realize that they had Zika infection. And so that's that. The worst case scenarios are if it does cause pregnancy problems, and people can die if they have a depressed immune system and other issues. So as with most viral infections, you're treating the symptoms, right? We don't currently have any medicines for Zika virus specifically. We don't have a vaccine, although scientists are certainly working towards that very heavily. Basically, rest, fluids. For your fever, you can take acetaminophen. Do not take aspirin. Do not take other non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen. If you were, for example, infected with dengue fever instead of Zika virus, or excuse me, if you were infected with dengue virus instead of Zika virus, it's been shown that those non-steroidal anti-inflammatory drugs can actually cause some bleeding, which we don't want. So to prevent it, well, let's talk about the life cycle first. So you may, especially if you just hear it, you may hear the 80s mosquito, right? And it's not the 1980s, right? It's this particular genus of mosquito. It is a vector-borne disease, which we've talked about, right? It's an arbovirus. And so basically, anything that you can do to prevent getting bit by a mosquito will help you prevent getting Zika virus infection. Right? So that would be wearing long sleeve, long pants, completely covered toes, mosquito repellent, mosquito nets, removing standing water if they're in your area, because standing water is what mosquitoes use to breed, right? You can go, if you've got an infectious disease outbreak, of course, you may start needing to get even more involved and start fumigating, which is definitely the appropriate action. Right now, even some scientists that really value biodiversity are saying we should just get rid of all mosquitoes because really the main thing they do is pass diseases, which mosquitoes do pass a lot of diseases, that's for sure. And so if we look at a little bit of the life cycle, what we have here is a female mosquito biting, injecting its proboscis into the skin. And what it does is it will kind of go up and down, piercing your skin, looking for an artery. And when it does that, it's also releasing chemicals that is an anti-inflammatory, it's a pain reliever as well, and an anticoagulant. So that you may be covered in mosquitoes and you don't know it because of this localized pain reliever that it's injecting into you. So it's going in, it's going in, it's going in. Finally, when it hits a artery, which we have over here, then basically what it does is it opens up its gut and it allows blood to pump into and fill up its gut, right? So your blood, red blood cells, a lot of really good nutrients that mosquitoes need, the female mosquito. And so if there are mosquitoes, if there is a virus, and in this case Zika virus in there, then what happens is the Zika virus is going to go up through the proboscis and into the gut of the mosquito. Right? So this is not drawn to scale. This virus is actually much, much smaller than anything else on here. Right? They're about 40 to 50 nanometers, which is tiny, tiny, tiny. Okay? But we had to draw it here, or I didn't, Washington Post artist did. Had to put it here so that you could follow it. So now that it's in there, what happens is the virus will then move through the body and will get into the hemolymph, which is like our blood. And then what they do is they end up in the salivary glands. And that's what we've got right here. Now we've got viruses in the salivary glands. That way, when the mosquito leaves this host, flies around, lives its life, and lands on somebody else because it needs another blood meal, well, now the fact that this virus is now laden inside the mosquito's salivary glands, which is what we see right here, when it starts feeding, it injects the saliva, again, which has the anticoagulant, which has the pain reliever, right? It also injects the virus. And so then that virus goes into the person that it's feeding on, and the virus can then disseminate throughout the body. We will see numerous times in this course this same type of mechanism for a variety of viruses. So this is a really important concept to understand how this works and how it is that various insects can transmit microbes. In this case, it is Zika virus in a mosquito. What you'll see is in other examples, the bacterium plague with its host insect, fleas, how it has a very similar type mechanism, even though they're very different insects. So that's how mosquitoes then fly around. They land on somebody that's infected, they fly around, they land on somebody else, they infect them, and one mosquito can infect many, many different people. So it's really important to get rid of all that standing water, et cetera. And we should do that here in the United States, even though we do not have any localized transmission of Zika virus that we know of. So let's just talk a little bit about this. Sometimes these figures can get a little bit scary for some people. Don't worry about it. Hopefully by now you've read through all of the influenza material. You've looked at the video so that this should look similar. And the reason I'm bringing up this right now is to show the similarities between this and influenza, which we already discussed, right? So first of all, let's go to this. What we see here is in this red, those are Zika virus particles, okay, in a transmission electron microscope. So that is not, very helpful in terms of understanding how it's actually built. So what we have down here is a diagram of what we believe Zika virus looks like. And if you look at it, it should be very similar to influenza. So inside, we've got the genome material. And in this case, it's RNA, like influenza, but this only has one strand of RNA for its genome. So let me ask you this, how many strands of RNA does influenza have? That's right, 8. Okay, so although it's got an RNA genome, like influenza, it's a little bit different from that point. Okay, so then what we have essentially is a capsid that's wrapped around it and then a bunch of proteins on the outside, right? So proteins sticking on the outside. Protein sticking on the outside of a virus, right? If this is the protein right here, the end of my fist, what is this fist going to do, right? So think about influenza, right? This is essentially the key that needs to find a lock to get into the cell, right? So that's what we see here. Here's another diagram of Zika virus. And so all of the proteins on the outside are what we're talking about. In this case, the yellow protein is binding to this sialic acid on a membrane protein. And so just like influenza and a lot of other viruses, it needs to bind to a receptor. And then basically what will happen is it will start accumulating closer to the membrane. So down below here, this is your cell, right? This is now a virus that has latched on to your receptors, and it is just about getting ready to go into the cell. Right? That's all we need to know about that. You don't need to draw this out. You don't need to understand all the specifics of this. But this virus will bind with its protein to a receptor on your cell, and that is how it gains entry. Because remember, viruses need to infect a cell in order to reproduce. Right? They're not like bacteria where they can just live wherever and start reproducing. These are obligate parasites. They must get into your cell to be able to reproduce. So right now, in terms of reported active transmission, what we can see is we're talking about Latin America, right? And so that's where it is right now. Now there's a case in the United States, but it's believed it's shown that was brought into the country. So there is, in terms of these active virus transmission, that is the key thing here, right? So if I were to travel to Latin America and come home, and there's I think last time I looked, which was yesterday, I think there were about 170 cases in the United States of Zika virus infection. But those people had traveled and they came back to the US. Right? So what's really important is that those people don't go somewhere where there's a lot of these Aedes mosquitoes and then they get bit and then start infecting, because that's how you then spread these diseases. And what we see a lot is global travel these days is so easy and so prevalent that somebody can pick up a disease somewhere, get on a plane, hop to another country, and then start spreading it. Now, it's not like SARS where if you're just spreading it out with your spittle and spraying micro droplets all over the place and people can get it. This is different because it is a mosquito-borne disease, mosquito-transmitted. So you would need to then have a high enough viral count in your blood to then have one of these same species of mosquitoes bite you, get infected, and then infect somebody else. Now, in Florida, and the discussion board has several people mounting in on Zika virus, so that's great. I figured that would happen. I'm very happy to see that. The case is that, you know, as it gets warmer and we get more mosquitoes, Aedes mosquitoes down in South Florida, the question is, will it start spreading, right? And so, for example, the governor of Florida, Rick Scott, he did declare a state of emergency, which allowed the state to mobilize certain healthcare infrastructure to help prepare for preventing or stemming the tide if Zika virus does start getting locally transmitted. So it's a huge deal. And if we look at that in terms of it being spreading, you know, these are numbers where when you look at it, you can really see the impact. So down here, we've got the number of countries that were infected between 2007 and 2011, and 2012 to 2014, and then January of 2015, and then going all the way through. So what we see is that we are in this upswing right now, right? It's March, and we see more countries. So will it keep spreading? My guess is yes, right? What I'm not showing here, and we can look at it another time, is increased number of cases, right? So you're reading about epidemiology this week as well in your material, and so you can think about how these numbers are being generated, right? So that's all I have for Zika virus. You know, this information is subject to change the more information we know, so I'm just kind of putting this date stamp on here. We will continue to monitor Zika virus throughout the rest of this semester. It's always important as an outbreak and an epidemic occurs of this scale that we take an opportunity in a class like this to keep coming back to it over and over and over again. So with that, that's Zika virus.